It differs in a couple of ways. At the signs and symptoms level, there's a lot of variability. The risk factors are pretty much the same, and they're the typical tobacco use, high blood pressure, high cholesterol levels, particularly a low HDL, high density lipoprotein, the good cholesterol levels, high LDL, low density lipoproteins, that's like the bad cholesterol, the one that typically gets laid down in the atherosclerotic plaque. Diabetes, much greater risk factor for diabetic women compared to men. For men, the risk of developing coronary disease is 3 to 5-fold increased. If you have diabetes, in women it's 7 to 9-fold. So probably speaks more to the small vessel damage that occurs with diabetes. Women may have more small vessels because we're just by geometry smaller. Those are the risk factors, so similar, but the presenting signs and symptoms are very different. So the typical male symptoms is the substernal crushing chest pain radiating down the left arm up into the neck, associated with maybe some sweating, shortness of breath. Women actually typically get those symptoms, but as opposed to men, we have more of the atypical symptoms. And so those are more kind of insidious symptoms, symptoms such as profound fatigue or profound shortness of breath. Just a change in your activities of daily living where you could easily bring in 2 bags of groceries from your car. Now just taking one in, you have to stop and be more short of breath. Those are actually common symptoms for women as a marker of the presence of coronary disease. Men don't really have that as much. They tend to follow the textbooks and have that Levine sign with the, crushing chest pain. Women tend to die more of their first heart attack. It's probably, again, another multifactorial answer. I think historically one would say that women were, the disease wasn't recognized in women, that doctors didn't recognize that women had it, patients themselves didn't recognize that they had it, but over the past probably 15 years, with the help of the media and the American Heart Association, American College of Cardiology, there's been tremendous advocacy and information that's been given. The American Heart Association's Go Red for Women movement, also the Red Dress campaign from the National Heart, Lung, and Blood Institute have been really, really powerful in teaching women themselves what their risk factors are, forcing them to know what their numbers are, know your blood pressure, know your cholesterol, know what your ideal body weight is, although maybe not all women really want to know what that is, or they already have a sense of they're not exactly where they need to be. To really empower yourself with knowledge so that when you go see your physician, you can have a more meaningful conversation. I really think all of those efforts together, and then also the fact that we did a little bit of education with physicians and said, we know that the Framingham Heart Study that started in the 40s, the first round of information came out in the early 60s. Really, that was, I would say, the seminal study that said that this is a disease of men. And everything that followed, there's a great cover of the Reader's Digest magazine that said, heart disease for women, what you need to know to keep your, loved one, your husband, healthy. Didn't even speak to the fact that more women actually die from heart disease than men do. But I think we've righted that. I don't want to call it a wrong, but we've addressed that. It took us a couple of decades. That's one aspect. Was the awareness. Awareness on the medical community that women are at risk, and women themselves that they are at risk. But also I think women tend to be masters or mistresses of multitasking, and so to take that moment for yourself and say, I don't really feel well, but I really need to go to work today. I have this presentation I have to make. My kids are getting off the bus at 3 o'clock. I've got my mother that needs to get to her doctor's appointment. We tend to take all of that on, and so we minimize, perhaps even ignore symptoms, and so there is a concern that women present later in their disease. And so when they finally do have that aha moment that maybe I need to go to the emergency room because I am what was now really profound fatigue, and I thought I wasn't sleeping well, but now my jaw is kind of bothering me, and that's different, they'll go to the emergency room. So they may present a little bit further down the road of the blockage being almost complete now.